My name is Dr. Kerry Yerkew, and today we're talking about patella femoral syndrome. Patella femoral syndrome is a condition where the kneecap doesn't glide through the knee area properly. There are condyles in the knee that allow the kneecap to glide through, and the cartilage cushions it so that there's no rubbing or clicking or grinding. Patella femoral can arise from a number of different reasons. The pelvis can be out of alignment, causing the tracking of the kneecap to be off. The quadricep muscle attaches into the hip, goes down through the kneecap and attaches into the tibia, the longer part of the shin bone. So if you're out of alignment, it can cause the kneecap to be out, and then it can start to grind and click. There can be weak muscles on one side or the other, causing the tracking of the patella to go through improperly. There can also be injuries to the knee and misalignments of the knee. So as a chiropractor, we want to look at the general alignment of the body, including the hips, as well as the knee, and then the way the muscles and the joints are functioning. I'm going to walk you through a few things that we look for on some anatomy drawings now. So when we look at the knee joint on an x-ray, what we're looking for is the alignment of the bones in between the knees. We want to look at the medial and lateral condyles, make sure that there's enough space between the femur, the long bone, and the tibia, and make sure that the fibula, this long thin bone, is lining up in the knee. As well as there's the patella right there, the kneecap, that's hard to see on this one. But if you look at the side view of the knee, you can see the patella right there, the kneecap, and it will glide over the knee through a groove in there called the patellar condyle. Here in the knee, you can see that the knee joint is opened up, and there's the patella, and there's the ligament, the patellar ligament, going into the tibia. And then in between the bones, there's these condyles that the bones touch each other on and rest on in order for the knee to work properly as a hinge. There are bursa that are going around the knees. So here you've got sacs of fluid that are surrounding the muscles and the bones. That prevents friction from the knee working properly and causing rubbing, causing inflammation. So what we want to see is that the alignment is good and the knee's functioning properly so that there's no friction or rubbing. Otherwise, the bursa will start to swell and you'll get bursitis. Inside the knee, there's a number of different ligaments and tendons running through there. I won't go over all those, but what I wanted to point out is that there's nerves running through there. The sciatic nerve divides into the tibial nerve, and then it also divides into the common peroneal nerve over here. And so those nerves run through the knee. And if there's any pressure on the nerve in this area, or even higher up in the hip or coming out of the spine, it can cause pain right down to the knee. So here's a diagram of the spine, and the nerve flow comes from the brain up top, goes down the spinal cord, and then right down here in the lower part of your spine, in the lumbar region, the nerve flow comes out through the sciatic nerve, travels down to the knee, and all the way down to the bottom of your foot. So it's important that we have the right alignment here and no pinching of the nerves down in the lumbar region, or else it'll cause pain sometimes right in the area, but other times it's a referred pain down into the knee or even down into the foot. So today's topic was on the knee, and specifically patellar femoral syndrome, which sometimes we call a moviegoer's knee, because people that have patella femoral syndrome usually are sitting at the end of the row in a movie theater extending their leg out because it's hard for them to keep their leg bent for a long period of time. There's just too much inflammation or swelling in there, and then that can cause pressure in the knee, and then it becomes uncomfortable. So to extend the knee, it takes the pressure off. As a chiropractor, we want to look at the overall alignment of the body. That includes the alignment of the spine and the hips. We want to make sure the nerve flow is getting through from the spine down to the knee. We also want to make sure the knee's aligned properly and there's good muscle strength on both sides of the knee so the patella, the kneecap, can track properly through the knee. If there isn't, a chiropractor's very good at realigning the knee, realigning the hips and the spine, allowing the body to be restored back to the way it was before, and then for the joints to function properly. That'll get rid of the swelling and the symptoms, and then you're back to your normal activities again.